topic is tooth sensitivity. Now, tooth sensitivity is one of the most frequently occurring clinical condition, yet a very difficult one to treat. Because to treat sensitivity, a clinician needs to arrive at a very specific and a definite diagnosis, which is only possible when the patient gives an appropriate history or symptoms. Now, sensitivity is broadly classified from a medical perspective into two types, that is pulpal sensitivity and dentinal sensitivity, which is also referred as dentinal hypersensitivity. Now, pulpal sensitivity is nothing but inflammation of the pulp, that is the blood and the nerve supply of the root or the tooth, or nothing but a root canal. And this kind of inflammation is caused by nothing but tooth decay. Now, pulpal sensitivity is further classified into two types, that is reversible pulpitis and irreversible pulpitis. Now, reversible pulpitis is nothing but just a mild inflammation of the pulpal tissue, and in such cases, generally the tooth is capable of healing by itself. Now, the most important feature to note here is that the pain or the sensitivity in such cases is typically of a very short duration, that only the tooth responds when the stimulus is applied, specifically like a cold or a sweet food stuff, and it lasts for only few seconds, and once the stimulus is removed, the tooth regains to a normal condition. And in such cases, the only treatment required is nothing but the removal of the decayed tooth structure, followed by a permanent restoration or a filling. In cases of deep cavities or deep decay, maybe a liner or a barrier cement is placed first to further decrease the post-operative sensitivity, followed by a permanent filling. That's it. Now, reversible pulpitis, if not treated at a right time, can lead to irreversible pulpitis, wherein the tooth is not at all in a condition to, heal by itself. The most important feature in case of irreversible pulpitis is that the pain is quite spontaneous and it is lingering even after the stimulus is removed, specifically like a cold food stuff or anything hot. And the patient remains awake at night, and the pain may become worse when the patient lies down, and in such cases the only treatment option available is a root canal of the tooth. The second one which we discussed was dentinal hypersensitivity, which is which most of the patients are quite aware of. It is nothing but exposure of the dentinal surface because of loss of a tooth structure or enamel due to multiple reasons. And the most uh, frequent or the most important reasons are that the most of the times, patient tends to overbrush the tooth, like overbrushing, especially with a hard toothbrush, can lead to damage of a lot of enamel or the outer coating of the tooth surface, which again causes exposure of dentine and then sensitivity. Again, on the contrary, if the patient does not brush at all, like if the patient is not maintaining a proper hygiene, a lot of plaque and calculus deposits, which leads to shrinkage of gums, which further leads to exposure of the root surface, which can cause again sensitivity. Third most important factor is your diet. Consumption of a lot of acidic foodstuffs like cold drinks and alcohol can again cause loss of enamel, which can lead to again dentinal hypersensitivity. Fourthly, it's a very rare but uh, a very extreme situation called as GERD, or the patient vomits, acidic vomits, which can cause like erosive cavities on the tooth surface, which can lead to sensitivity. Now, the treatment in cases of dentinal hypersensitivity is that most importantly is to remove the causative factor. The main cause of the sensitivity has to be recognized, and accordingly the treatment has to be planned. Secondly, in cases where the dentine surface visibly is exposed, can be treated by a simple topical application of a desensitizing toothpaste, wherein the paste directly block the exposed dentinal tubules, which can cause decrease in sensitivity. Now, thirdly, in cases of extreme deep facets or cavities, or where this extreme cupping of the tooth, it where the cupping has lead to extreme loss of tooth structure, uh, the best treatment option is to get a root canal of that tooth done. And that's all about sensitivity. So that's it. To achieve or to treat any kind of sensitivity, there has to be a specific diagnosis. Only then a proper treatment can be attained. And to achieve a proper diagnosis, again, patient has to give a proper history and the symptoms based on which only the patient can be relieved of a sensitivity.